For the last 15 years or so, we've been deeply involved in the development of new forms of immune therapy for people with solid tumors, specifically melanoma and kidney cancer. We've known for a long time that in certain cases, the immune system can be boosted in a way that can create remissions of cancers. Over the last 5 or 6 years, though, we're getting much more focused in our treatments that are producing longer-term benefit for more patients with fewer side effects than we've seen in the past. The trial we've been involved with for the last several years focuses on a new form of immune therapy, a class of agents called PD-1 antibodies. These antibodies were developed based on an understanding of how the immune system both not only turns on in response to cancer, but more importantly shuts off when cancer is around.
So more fatigued.
Yeah.
How are the joint aches?
Jerry is a patient of ours. We've known him for several years. He has advanced kidney cancer.
They detected some spots, and then bingo, it exploded. I was just full of it.
He came to us initially for one of the older forms of immune therapy, interleukin-2. And we gave it to him, and he tolerated the treatment relatively well, even though it has a lot of side effects.
Unfortunately, after his treatment, his CAT scan showed us that his disease had not responded. So at that point, we were looking for other potential treatment options for him. And there was a slot available on the PD-1 clinical trial, and we were very excited about that.
The way this approach works is it targets a specific protein that's found on T cells once they're active. And it's normally there to help shut down T cells once an infection is controlled. But obviously, shutting off a T cell is not what you want to do when you're dealing with a tumor versus an infection. You want those T cells to remain active. These new agents get in between that interaction between the tumor and the immune system and block some of the natural shut-off valves that these T cells can have and keep them alive so that they can do their job.
I've been on this treatment for a year, and right now it's doing aces for me. Everything, my understanding, it's allowing my system to fight the cancer.
Currently on the scans, he has nothing in the liver, and his lung lesions have certainly gotten smaller. So he's in a great spot. We hope that he's going to continue to improve and tolerate the drug as well as he is. I'm excited by the low side effect profile. Not to say that there aren't some serious side effects that can occur.
They seem tender, more tender.
Tender to touch, sure. But since we're well informed about them at this point, I feel like we can manage those very readily. Patients tend to feel well while they're going through this, and they can lead their lives and carry on, and that's important. Quality of life is an important thing.
For me, to walk in the park. I mean, it's an easy protocol. Every 2 weeks I come up and they do the blood works and infusion. The side effects, I'm super tired for a day or two after. I had a rash for a while, and I had different stuff for a little while, but it only lasts like a week or 10 days. Nothing that I would not do again for the results that I got. You know, I feel good, feel real good.
It's too early to know what percent go into remission. What we know now is what percent have major shrinkage of their cancer. And in kidney cancer, that number is about 30%, which is a good number. It's not a great number. What we need to know, and it will take several years to figure this out, is when these patients come off treatment after 2 years of treatment, how many of them stay without their cancer growing? To me, that's the definition of a remission.